Begala, who is joining us now, a former advisor to President Clinton. Paul, thanks so much for being here with us. I first just want to get your reaction to this news that I think everybody, Democrat or Republican, is trying to absorb right now. And as Betsy was alluding to in talking to people who worked with the former president, there is a lot of surprise and shock and sadness.
Well, there is. I will note that Joe Biden is a man of powerful, profound faith. He's a brother Catholic. And at moments like this, especially Joe Biden turns to faith. He has been through this. He lost his son, Beau, of course, to cancer. So I am praying for him, and I ask viewers to do the same, politics aside. But think about this. There's a better than 1 in 3 chance, if you're watching this broadcast, better than 1 in 3 chance that one day you will be sitting in a room with bad fluorescent lighting, and the doc will say to you, "I'm sorry, it's cancer."
It often presents with high Gleason scores, indicating a more severe cancer type. Symptoms may include frequent urination, blood in urine, and pelvic pain. When it comes to treatment, options vary based on the cancer stage and patient health. Common treatments include surgery, radiation therapy, hormone therapy, and chemotherapy. Surgery involves removing the prostate gland, while radiation can target cancer cells directly. Hormone therapy aims to reduce testosterone levels, slowing cancer growth. Chemotherapy is typically used for advanced stages, targeting rapidly dividing cancer cells. Survival rates for aggressive prostate cancer can be concerning. The 5-year survival rate for localized prostate cancer is nearly 100%, but for advanced stages it drops significantly. Early detection is crucial as it greatly improves outcomes. Regular screenings and awareness of symptoms can lead to earlier diagnosis and better treatment options. In recent years, advancements in immunotherapy and targeted therapies have shown promise. These treatments harness the body's immune system to fight cancer or target specific genetic mutations within cancer cells. Clinical trials are ongoing, offering hope for improved survival rates and quality of life. Support systems include counselling and support groups. They play a vital role in coping with the emotional and physical challenges of aggressive prostate cancer. Engaging with healthcare professionals and loved ones can provide necessary support during treatment. Overall, aggressive prostate cancer requires a proactive approach, combining medical treatment with emotional support. Staying informed and connected can empower patients and their families in navigating this challenging journey. We wish President Biden and anyone else who's currently going through being diagnosed with prostate cancer and treatment, we wish them strength and the best possible health.
But there's hope. You know, cancer deaths are down 33% in the last 34 years. This is one of the great passions of my life. I'm on the board of advisors of the MD Anderson Cancer Center in Houston, the world's foremost cancer hospital. I'm not an expert, but I care a lot. I lost my dad, my stepfather to cancer. I care a lot about this. And people need to know that there is hope. And the engine of that hope has been American research. And I have to say, it breaks my heart that people in Washington are talking about cutting the budget for cancer research. I'll give you some data. The National Cancer Institute, the largest funder of cancer research in the world, our National Cancer Institute, the federal government's, it only spends $7.2 billion a year on cancer research. That's it, on a disease that 1 out of 3 of us will get, $7 billion. Okay, we just had Easter 5 weeks ago. We spent $22 billion on Easter. We spend $15 billion on Super Bowl parties. I mean, one of the great things about Joe Biden is the passion he has brought to fighting cancer for all of us, not just for his kid and not just now for him. His cancer moonshot was revolutionary. And I got to tell you, I'm praying for Joe Biden, but I love that old African proverb that says, when you pray, move your feet. And I want to move my feet and start to pressure these politicians in Washington to do something more on cancer research, more and better research, which is working, rather than cutting cancer research. It's the wrong thing to do.
Yeah, it is incredible just how much cancer runs through the story of Joe Biden, both as a father and as a president, a politician, a vice president. As you mentioned, he lost his own son, Beau, to cancer in 2015. Then he and Jill Biden spent so much time, both when he was vice president and then as president, on the Cancer Moonshot Initiative. This is something, and as Dana Bash was saying, and when I covered him, he's so well known for consoling people, he calls everyone to talk to them, to console them, to check in on them, to make sure they have what they need if they're sick or ill, especially when it comes to cancer, because he's experienced it in his family. And so now for him to be experiencing this himself, it's such a moment.
Well, it is. And, Hemingway said, life breaks us all, but some emerge stronger at the broken places. Man, is that Joe Biden. He is a guy who cruel fate has broken him so many times. He's borne more pain than anybody I know. And yet he is empathetic. He doesn't just say, oh, I've had a lot more pain than you, and so I don't really want to hear about your pain. Always reaching out, always helping, and always doing. His public life, he has spent more time in public life than, half a century. And one of the hallmarks of it has been this remarkable Biden empathy, and especially on cancer. His cancer moonshot and the emphasis that he put on cancer research, where we lead the world. America is the world's leader. We have the smartest scientists from all over the world who want to come here. And I have to say, I'm terrified. I hear reports. I talked to somebody yesterday who was talking about somebody who was offered a job in medical science and left to go to Europe rather than to stay here. So I do think there are things we can all do. The most important thing is to pray. And then after that, to support research into this disease, because it knows no partisanship. I'm telling you, cancer doesn't ask, are you a Republican or a Democrat? And that we shouldn't ask which party we're in when we're looking to fund the research also.
Yeah. And look, there is the humanity of this, which I think we have certainly been able to get at in this conversation. There's also inherently kind of the politics piece of this, which is this was going to be a week where Joe Biden and his family were going to see the release of this book by our colleague Jake Tapper and Alex Thompson that focused a lot on his questions about his mental acuity and his fitness for office and all of these questions, which now, he has to deal with this announcement that he has this aggressive form of cancer.
It is terrible timing. I will say, it highlights the need for more transparency, medical transparency for our presidents, irrespective of party, irrespective of the individual. We need to know more. Just like we need to know more, I would have much greater transparency about their financial health as well. I want to see their tax returns, every bit of business. But we have a right. The third president, Thomas Jefferson, said when a person becomes a public official, they become public property. And so I do think that's legitimate. I think Jake's book is going to be very important. It's terrible timing for President Biden as a guy and his family, and I hate that. But there are larger issues here. I will note, as an ardent Democrat, it's really important that I speak up and thank President Trump for his gracious statement. His son, Donald Jr., issued gracious statements. This is important. I'm not somebody who's generally a big Trump fan, but I do admire that President Trump today and his son put out public statements of support and encouragement for President Biden and his family. That's really important.
All right, Paul Begala, thank you. It's nice to see you. I'm sorry it's to cover a story like this, but thank you so much. We appreciate it.
Thanks, Jess.